Welcome to the advising session for the Basic Track RN program at Lone Star College-Montgomery. You may be brand new to Lone Star Montgomery, and if you are, welcome. There are a few things that you can do to get started, including applying to be a credit student at the college. You could do that downstairs in the C building, first floor, student services. They can assist you, or you can do it online on our website, lonestar.edu. They may require you at admissions or advise you at admissions to take some TSI assessment testing in reading, writing, and math to determine if you are at college level and able to enroll in all of the prerequisite courses for our RN program. Make sure that you are aware of our very important immunization policy. See our website for the latest details. Right now, our policy states that you must prove that you have a positive quantitative hepatitis B titer at the time that you are applying to our program. The series of shots for hepatitis B can take up to 6 months to complete, and then your titer is drawn after that, approximately 6 weeks after the last immunization. So you want to put this on your immediate to-do list so that it doesn't hold you up from applying. Any student with a negative quantitative titer should contact the nursing department to see how to handle their particular situation. After acceptance to the program, quantitative titers for MMR and varicella will be required as well. See our immunization policy on our website for more details. Let's talk about the Associate Degree Nursing Program, Basic Track. This program is going to last approximately 2 years after you start taking the nursing coursework. You are eligible to test for your RN licensure with the state of Texas after you graduate with an associate's degree in nursing. Kingwood College and Cy-Fair College start their program each January. Kingwood is the only program that offers the Basic Track RN where the lectures are taught at night. The rest of the programs at the other campuses are traditional daytime programs. Our program here at Montgomery, along with North Harris, Cy-Fair, and Tomball, also have a fall start program. Now you're usually applying at least 6 months ahead of time, so be aware of the deadlines. You can see a link on this slide that will take you to the current deadlines on our website. Or if you're anywhere on our website, just type into the search bar at the top right-hand side of the website, Nursing Deadlines, and you will find that correct page with all the deadlines throughout the entire Lone Star system for all the different nursing programs. So how do you know what classes you need to be taking to prepare yourself to be a good applicant for the Associate Degree Nursing Program, the Basic Track program? Well, the most important classes are the 2 absolute prereqs because you can't apply to the program until you've made good grades in these classes, and those are listed here in red. Biology 2401, Human Anatomy and Physiology 1 within the past 5 years, and English 1301. Your GPA, when you average those 2 grades together, must be at least a 2.7 or higher to be eligible to apply. Please note, you need to aim high. Try for A's in these 2 courses in order to make your application more competitive. See the score sheet. Here's a list of additional courses that we do not require you to have completed by the time that you apply to our Basic Track RN program, but we do strongly encourage you to complete these courses prior to starting our program. The reason is the program is very intense, and we want you to have these courses out of the way to provide a great foundation for the program, but also so that you can focus in on your nursing classes and not be overloaded with coursework. So you must make C's or better in all of these courses to count towards our nursing degree plan at Lone Star. Biology 2402, Human Anatomy and Physiology 2 within the past 5 years. And just a note, if you didn't make an A in Biology 2401, you have one more chance to make that A in Biology 2402, and it will be averaged with your English 1301 grade on the score sheet. We're going to get to the score sheet in just a minute. Biology 2420, Medical Micro within the past 5 years, General Psychology, Psych 2301, and one course off of the approved list. One 3-credit-hour course off of the entire list of Creative Arts, Language, Philosophy, and Culture electives. That list is available on our website. RNSG 1301 Pharmacology within the past 5 years. This is the only RNSG class that you're allowed to take prior to being accepted into the nursing program.
Okay, some additional information regarding choosing courses. Some students will be required to enroll in a NCBO math course based on their placement test scores prior to being eligible to enroll in a biology course. If you're looking for which college level math to choose to link with that NCBO, one recommendation would be to take Math 1342 Statistics. This is because this class is on most BSN lists. Another choice might be Math 1332, Math for Liberal Arts. This would be for a student who wishes to improve their basic math skills. Remember that no college level math class is required for this particular program, the Basic Track RN. However, these are just recommendations for what to link with your NCBO should you be required to take an NCBO in math due to your placement test scores in math. Next, we'll talk about the Creative Arts, Language, Philosophy, or Culture elective. Some choices might be Philosophy 2306 Ethics. The content of this course is very applicable to students entering medical professions. Another choice might be any of the creative arts on the approved list. Another thing we should discuss is the order in which I recommend you take the biology courses and your pharmacology course. Remember that each biology course is very intense and will require quite a bit of study time. Most students will tell me that they spend at least 25 hours per week that they dedicate just to a biology course in order to try to do well in that course. During a regular 16-week semester, 25 hours per week is a lot of time. So just keep that in mind as you balance work and life and school, and you plan how many courses you're going to take each semester. So most students will take these one at a time. So the first semester they'll take Biology 2401, the second semester 2402 Biology, the third semester 2420 Biology, and the last semester Pharmacology, RNSG 1301. The reason for taking pharmacology last is because the faculty at Montgomery that teach this course will tell me that the students who have taken more of the biologies have a better background, are better prepared to do well in pharmacology. And lastly, I will recommend that if you have a break, you need an extra class to take, you don't want to take a semester off while you're waiting to start the RN Basic Track program, that you look at the RN to BSN Core Plus Psych 2314 list, and we'll definitely put that link in the description for this YouTube video.
I'm just showing you a picture of a form that we will definitely link in the comments for this YouTube video. But this is our checklist. It's designed for you to read through it and check things off as you prepare to be a good applicant for our RN Basic Track program. And then this is our score sheet. We're going to talk about this for a moment. Box number 1 has to do with your grades in the 2 prereqs. So you want to earn A's here if you possibly can. It is a minimum of 2.7 when you average these 2 grades together. And the 2 grades are going to be your English 1301 prerequisite class, English Comp and Rhetoric 1, And the higher of either Biology 2401 or 2402, whichever is higher, both have to be within the past 5 years, both have to be C's or better. But the higher grade will be averaged with your English 1301 grade. So minimum GPA of 2.7 when you average those two grades together, but the higher the better. If you can have a 4.0, 2 A's in this box, then you're going to be more competitive, and I would highly recommend that considering the competitive nature of this program. Box number 2, that is the HESI results. So everyone that applies to any of our nursing programs, whether it be the LVN program or the 2 RN programs, they will take a HESI A2. It's a pre-entrance test, and you'll notice on the left-hand side it mentions 5 sections that are required, and you must make a minimum score of 80 on each of those sections in order to be eligible to apply. And then in the middle it talks about an additional section, the critical thinking section, which you must make a minimum of 750 on. The scores that go into your score sheet are on the left-hand side, so you're going to have an average of 5 scores, and then that average is going to be divided by 25 to put it on a 4-point scale. So most people are going to end up with a 3 point something something something. So for example, a 3.567. That would be your score in box number 2. We don't round up on that to try to avoid as many ties as possible. And so you would have your 4, hopefully, 2 A's in box number 1 added to a 3.567, for example, in box number 2. So you would have a total score of 7.567 out of 8 possible points. And that score, your total point score, is going to be compared with all of the other applicants. And that is how we choose who gets to start the program and who is placed on an alternate list for the program in case some people who are accepted decide not to come to the program. We will have an alternate list that has already been oriented and has gone through the background check process that we can move them into one of our positions at one of our campuses. Just a few additional notes. All classes, in order to count in selection criteria or the score sheet, must be completed prior to the application deadline. We can't look at anything that is currently in progress. We've already talked about the HESI, but there's a couple of notes here. Some additional notes about the HESI. You will notice when you look at the deadlines that are posted on our website that usually the deadline to take your HESI is at least a week, maybe even 2 weeks prior to the application deadline. The application deadline is by 4 p.m. on the application deadline, and then 1 to 2 weeks earlier is the last day for you to take a HESI test for that particular application period. You can choose to retest on the HESI every 61 days. And that's if you desire. It's not required, obviously. If you like your scores and you want to just keep those scores, they are good for 1 year. If you do choose to retest, we will use your most recent test score on all sections. A few additional notes include there will be a verification of your Social Security number prior to clinical placement. There is also an English proficiency requirement for those that did not attend high school in the United States. And if you look on our website, there's a handout or a section about our English proficiency policy, or you can contact me and I will help you find that link. And in addition to that, health insurance is required for students in our nursing programs. More information about that would be provided by your director of the program that you're accepted to at orientation or in your acceptance letter.
Candidates for Texas licensure in nursing will also need to pass a fingerprint background check. This is actually done before the student will enter our program. Individuals with a history of felony convictions, mental illness, and/or chemical dependency will be considered for licensure on an individual basis after review by the Texas Board of Nursing. If you have questions about this, see the website for the Texas Board of Nursing, specifically the declaratory order. Nursing programs also require a pre-admission drug screening. I would like to leave you with some contact information that would be very important should you have questions that come up as you pursue your nursing education. My contact information is here. My name is Amy Robertson. I'm a faculty counselor, along with Caitlin Long, our division's operations specialist, and Lynette Dempsey, our health occupations program coordinator. Please email us should you have any questions, and we can set up a time to discuss your questions, or we can answer those quickly over email, whatever is appropriate. We look forward to visiting with you, and we also look forward to seeing you pursue our nursing program in the future. Good luck with your education, and let us know if we can help.